Assalamu alaikum and welcome back to my channel. I am Dr. Atufa Kaleem, and today I have invited my doctor colleagues from Norway, and we will discuss in today's video about the becoming a doctor and journey to be a doctor in Norway. So this video is going to be very informative for those who are wishing to come to Scandinavian countries. So Norway is one of the best country in the world. So today I have invited Dr. Azmat, who recently went to the Norway and he started his journey in Norway as a doctor. And we have also with us Dr. Ali, who is there for many years and he has completed his journey as a doctor in Norway. So I welcome both of you, Dr. Azmat and Dr. Ali, to my channel and my video. Assalamu alaikum and welcome to my channel.
Alaikum. Thank you so much for inviting us.
Yeah.
Assalamu alaikum. Thank you very much.
So first of all, when doctors apply from different countries to Norway, they have to apply for verification of their qualification as a doctor to the Norway Medical Board. And when they apply for verification, there is some time which they have to wait for their approval to come, and then they will apply for their visa so they can go to the Norway. So can you tell me from the recent observation that what is the processing time for that approval nowadays? I think Dr. Azmat can better tell us because it's a recent thing. So
Yeah, thank you. When I applied at that time, the processing time was up to 7 months. But these days, due to overburden and due to some other problems with the verification of degrees, especially from Pakistani graduates, there are some issues, and it is taking about 15 months only for for this temporary license to obtain. Uh, it's a 3 years license, and you have to come to Norway and start your language journey, and you have to complete it you have to try to complete it within 3 years. Visa processing, you
Yes, as Dr. Azmat said, the most important step is to get temporary license. This is for 3 years. So they issue license for 3 years to all the graduates that are from Europe and also from Russia and from China. Some Chinese medical colleges have 6 years medical degree and some has 5 years. Now we come to Pakistan, India, and other countries. If you have 5 years medical degree plus house job, then they can issue you a temporary license. But at my time, they were issuing to everyone 100%. There was not even a single case of refusal. But now they are demanding some from some graduates 3 months practice in neurology and 3 months in psychiatry.
okay.
Yeah, and it's taking almost 15 months.
Okay.
So yeah.
So
After getting this license, there are two types of licenses, by the way. One is for a medical student and one is for a doctor. You can apply for both. If
and
you
what
get yes, if you get rejection for license as a doctor, then they advise you to apply as a student. So the student license is for 1 year. So on both licenses, you can apply for visa as additional education to come to Norway to complete the requirements. And there are three main requirements. First one is language. It takes almost 1 year if done with dedication. Then there is an exam called Nationale Fag and Legemiddelhåndtering Håndtering. This exam is about national guidelines in Norway and drug regulations in Norway. It is so easy. I actually did it in like 10 days. So I had job as a doctor at that time. But you can start job as a doctor after learning language. You don't need to pass these languages to start job as a doctor.
So, you said that there are two types of visa here. One for the as a student, doctors can come here. What is the
Yes,
requirement for that?
uh, passed all the subjects except final year. If you are passed, for example, in Pakistan and India and
Hmm.
Bangladesh, if you have passed 4 years of medical school and you are in the final year, and you have a date of your exam, uh, for example, exam will happen in July 2025. So you can send that confirmation date or date sheet of the exam to them, and then they will issue you a license as a student doctor.
So it's a new thing that I came to know, and
Yeah, it's it's a new thing. We also
oh,
came to know this recently. The people
hmm.
who got rejection as a doctor, then they applied for a student doctor, so they got this license.
Okay, that's very nice that they can start their journey right from the student life here. And the second, for those who are coming here as a doctor, you said that they only require to pass language to work as a doctor. They don't need any medical exam in Norwegian language.
Yes, there are exams, but
Okay,
you can have a job. I started having doing my job as a doctor after my language. You can start
okay,
working as a doctor, and after that, I helped many colleagues because here you need help from people. Without help, you need to pass everything and to get a job.
okay. So, as a doctor, you can work here even without passing medical exam. I'm asking this again and again because in Denmark,
Yes.
you cannot work without passing medical
No,
exam,
no.
and then
I worked for 2 years without passing my final exam as a doctor. But
okay,
you have full rights to prescribe medications, everything. But one thing is mandatory: you need a supervisor until you
okay,
pass your final exam.
okay,
There should be a supervisor, and you have to report it to the government authorities and health directorate that this person is your supervisor.
okay,
You cannot
okay,
work independently.
okay.
Yeah. But your
So,
salary, your income, everything is too good.
can you tell us a rough figure that what is the salary, average salary for a starting doctor?
Like the minimum is 50,000 Norwegian crowns. The minimum, if you work as an assistant doctor or least one position in a hospital, or
Hmm.
there are also like in English, I actually forgot English while learning
Yeah,
Norwegian.
I can understand. Yeah.
Like CKM, there are different communes here. So CKM means nursing unit.
Hmm.
like
Uh,
nursing homes
yeah, yeah.
for elderly
One doctor
people.
is always needed there.
So, you mean to say that before passing medical exam, doctor can work as an assistant, not as a
Assist-
doctor?
no, no, they get salary, full salary as a doctor, but the title is assistant doctor. So
Yeah,
you
this
have
is the same in the Denmark. So they can work here in Denmark. We can work, but not as a doctor. We need to be titled as assistant doctor, and we also need supervisor who can prescribe. We cannot prescribe, but we can work.
but in Norway, we can do everything. We can prescribe medication
Okay,
and we can write our notes even without like supervision. But they say that there should be a supervisor if you need it. So
okay,
there should be a name.
hmm,
There should be a person physically.
okay,
Yeah. For example, when I was working in a GP office for almost
hmm,
2 years.
hmm,
So, like 5 days a week, I only consulted maybe once, and other
okay.
4 days I never consulted. But still, I had the opportunity. This is the requirement. You should have the opportunity. You should have a person.
So, if you did not consulted the patient, then you just examine the patient.
Yeah, you can do whatever you want. You will work completely as a doctor. You will, for example, a patient with comes with sore throat. You will
Mm-hmm.
do. You will take history. You will write your notes. and you will do, for example, some quick medical tests, and then you will prescribe medication, and that's it. You will take your next patient. So this is lawful to do, but government authorities know that on that day there was a senior doctor present, because
Hmm.
everything is electronic here.
Yeah, and this is the same, I think, in Denmark. It's the same process.
Yeah,
So,
maybe, yeah, they are same.
yeah, yeah. But it's and for becoming a doctor, of course, I think you also need a medical exam in Norwegian and legislation exam that you told me.
Yes, this is not easy exam. The language takes 1.5 years for people.
Hmm.
I did in 1 year, but I did too much effort.
Hmm.
So this national regulations exam, it takes 4 to 5 months average for people. I and there are proper classes for this. You have to pay fees. The one bad thing is about Norway, you need to pay for everything. For
Okay.
language, you will pay yourself.
Hmm. And what is the fees for that and how it is paid?
Like if you do it from University of Oslo, I did it from University of Oslo, which is like around 18 to 20,000 for A2, same for B1 and same for B2. So
Okay.
on average, it is 60,000 for
Oh,
3 modules.
okay. And how much module is there?
Three,
Region. Okay, three module is total.
yes, and
And
you need to do odd jobs while
okay.
learning your language.
Yeah, to survive.
Yes.
And is there any score which is required to for doctors?
First two, I think there is no score. In the third one, there is a C grade minimum.
Okay,
Yes.
because in Denmark, it's a very high score that doctor has to achieve.
Yeah, I'll continue with this one with language. Here are different ways to pass language. For example, as Dr. Alice told you, that you can go through the universities. It's University of Oslo, University of Stavanger, Bergen, and you can go on your own. For example, from some private schools, you can learn the language, and you'll have to go for the Norwegian competence exam. It's equivalent to the same in it's for those who cannot attend university due to different reasons, and it's a cheaper one. Going through these schools are cheaper, private schools, but the exam is very tough. For example, you are sitting in exam B2, and the examiner will assess after your results that which grade he will give to you. For example, if you will go for B2 and he can award you only A1 or A2 or B1, whatever he can, and in different types, for example, listening and other speaking, they will assess and they will give you the marks. I have seen some pharmacists who took this exam and they were stuck for 2 years and even more, and the problem here is that they will give you visa only for 2 years. Within 2 years, you will have to pass your language, and you have to find a job in your own profession. Otherwise, third visa you won't get.
But
Here, visa is 1 year visa. Always.
but you said that in the start that then give you 3 years visa.
No, no,
No,
3 years license. Visa is only
license
two.
is 3 years.
The visa is the 1 year at a time, and then you will get 1 year renewal. Visa is 2 years.
Okay,
And
two
it's
year
strange these
visa
days,
and
even
Three
1
years
year.
license.
it's strange
Okay.
these days as renewal after 1 year. If you apply for the renewal of your visa, here the directorate will check if you have enough things you have done so that they can renew it. And renewal of your visa is taking 6 to 8 months minimum. That is
Now this
renewal,
is, yeah, like it now.
and you
Okay.
are living here only on the letter that you can stay here.
Okay.
It's a bit difficult these days here.
Yeah.
It was
And
too good like 4 years back. it was very much good. When I came 4 5 years 6 years, the story was different. It was taking only 4 months to get a license. Then people were getting job after B1 and straight on work permit after 8 to 10 months. And now, like, license is only taking 15 months while sitting in Pakistan or Bangladesh or India, wherever you are. After, you need to wait another maybe 1 year for your visa, 2.5 years. Then when you come here, 1.5 year minimum you need to struggle to pass the language. Once you learn the language, then things are easy. Other exams you can do.
Hmm. And tell me about cities. Which city is best to start your journey, or comparatively, it's good to start from which city?
Mostly people started from capital Oslo. I'm
Oslo.
also here. I started from here. Dr. Azmat is in Stavanger. If you are well prepared, like if you learn language, Dr. Azmat is a very huge example. I'm impressed by him. He he's at B1 level now. He will enroll in B2. He's between B1 and B2, and he did in like 6 months maybe.
Yeah.
Okay.
So how you did in 6 months, Dr. Azmat? Can you tell us?
Yeah, sure. That exam, online exam, and then they can offer you a free of cost place in their group. And I got all the time. I got the same, and I'm still free of cost. I'm learning the language. Other than that, they have spoke cafes, like speaking cafes, where you can go and online. They have online and Red Cross, Caritas, and there are other organizations. They have also their sittings in different places in libraries and in their offices also, where you can go and speak the language. But it's upon you, it's your struggle. For example, I visit these cafes almost 4 to 5 times a week. Every time when I find somewhere, I go and start the speaking. And very first day when I visited first time in my life this cafe, I could not say even a single sentence of the language. But after sometimes you start learning, and you have to be very dedicated to your language. You must follow your language as it should have been. Don't concentrate too much on your odd jobs, it's only for your living. But concentrate on your main aim. And all the time you are running after your language. Every day you will have to spend a few hours for vocabulary, for reading, listening. For example, all the time, whenever I go somewhere, I am with iPod, and I always listen to the language all the time. Even traveling anywhere, uh, it's in my ear, and I have to listen to the language only. So you have to be very dedicated for your language. Thank
And how are the schools that you join for language?
There are different schools, and some are good, very frankly, and some are not so good. That's why once in even group of Denmark, I asked about which schools are better, because here you can find very good school as well as not so serious schools. They offer other things which are not related to us. Uh, some schools are very good. It depends upon your teacher. It's your luck.
And fees is same in all the schools, or it is
No,
variable?
no variable. It's same
Okay.
like private schools in our countries also. Different schools take different
Okay.
fees.
So
But I
it's
would
a
like to
no.
add, yeah, I
But
would like to add.
luckily I got all the time free of cost. They took the exam. They have some seats which are sponsored by the government. Government pays them, but they take the exam and they select them. The Some students, I was one of the luckiest to get the seats free of cost. I haven't paid till now even a single crown for a language course.
So what is that lucky criteria on which you can get?
They send online test. You have to take this test. If you get
Okay.
enough marks, for example, I all the time I took more than 92%. and
What type
that's why
of
I got.
test is that?
For example, if I want to go for A2, right,
Okay.
the test will be about A1. If I
Okay.
want
Yeah.
to apply for B2, the test will be about A2, how I know the A2 language.
Can we expect that if someone come to Norway while learning A1 from their country, they can go and give test for A2 and start free language?
It's not always. It's not always.
Okay.
The scholarship is not always available. Sometimes they offer, sometimes they don't offer. You
I
have
would
to
like
search.
to I would like to add that this is very rare. This scholarship is
Okay.
like in 2024, from when Dr. Azmat came, there were many scholarships. But in
Hmm.
my time, there was no scholarship. I got only one scholarship for 30 days. I was in A2 at that time, like 10,000 crowns. I got deduction. So there are schemes from the government for the people who are migrating from other countries.
Hmm.
But the main thing is, if you are dedicated, you can learn language while sitting at your home online. Even there are language centers in Pakistan. So you can have physical classes, you can have online classes. If you want to come to Norway, then you need to be dedicated. If, for example, you learn B1 while sitting in Pakistan, here you can land directly on your job. I can promise. In 3 4 months, you will be on your job. You don't need to do odd jobs.
Okay. And the job that doctors do while learning language, is it full time allowed for them?
No,
Only
20 hours per week.
Okay, not full time.
no,
No, no, it is not allowed full time.
Okay. You told me that as assistant, they can work in nursing homes or assistant to clinic,
Doctor in GP
physician.
clinic,
Yeah, GP
they can
clinic.
also get at least one positions. One guy from Australia got it. He was with me in
Hmm.
final exam of medicine. He was the luckiest one I saw. He graduated from Australia. He had wife here,
Hmm.
so he learned language in 5 6 months because wife was doing job and he was only studying. And he was living far away from main city, like there you can say that in a small village, and there is a hospital. They needed a person who lives nearby and who can come whenever they call him. So this worked for him, and he straight went into the specialization. This is called least one, even on temporary license. And
Okay.
he passed all the exams in 1.5 year. 6 months language, 2 months he did nationale fog, and 4 5 months he did fog prove. So after 1.5 year landing in Norway, he was into specializing pathway, and now he's independently working.
So I think that was the rare case. We cannot exemplify him.
No,
But
no, no, no,
for
no. This
others,
is very rare case.
hmm. But
But
for
I'm just
others,
yeah.
what other job options are available for,
The most
like in
easy.
Denmark, we have to do odd jobs. Doctors has to do odd jobs, like they have to do kitchen assistant or even cleaning jobs or delivery jobs, food delivery jobs. So these kind of
Same
jobs
here.
doctor do.
Yeah, same here. If you have no
Okay.
sport here, you are coming along. You have to do these jobs for, I would say, minimum 1 year.
Hmm.
On average, 1.5 year. You need to do these jobs until you get fluent in your language.
Okay. And how is the language? Because I am surprised that language is doable in 6 months. In Denmark, it is very difficult language, and people do it. Those who are very intelligent, they even they can do it only in minimum 9 months. So on average, people spend 1.5 year for learning language properly.
Actually, Dr. Asmat can reply better, but I would say 6 to 9 months are okay to get certificates. But I became fluent after starting my job as a doctor, after starting communication with colleagues and patients. You are not fluent in 1 year. You only get certificates.
And one thing I think is that there is no specific grades that you require in Norwegian language, but in Danish language there are very high score that we have to attain to work as a doctor. Only for
Uh,
doctor that require.
No, this is not like it here.
So this make things easier. And the jobs that you are telling me for doctors, how to find those jobs? What is the
The
easiest?
best thing is to like have some references. When you come here, you meet people of your country. This is the best thing, to have references, and they will help you. For example, if there's a GP clinic, 4 GPs are working there, they will just put one extra chair and computer, and you will start working there. They
Yeah.
don't need any approval from anyone if they
Hmm.
are willing to help you. The second thing is, if you don't have referrals, just apply. The easiest one is to get a nursing home doctor, because the doctors who have full authorization and full working rights, they don't like to work there.
Okay, so the main thing I think is the same that in Denmark is networking. With only networking, you can get better jobs and better options. And also, it will help in learning language earlier.
Yes.
So that minimum salary that doctor earn, is it easy to maintain your family and yourself in that salary and also learn language, pay fees for the language?
No, initially it's very hard.
Hmm.
Until you get to your doctor job, it's hard. I would say it was very hard for me.
Hmm. And how
Doctor
are the
so being alone, it's not so tough, but with family, it's very tough. For example,
with
uh,
family, I would say it's next to impossible. So
yeah,
I did
because
this mistake. So don't come with family initially.
yeah, because you are allowed only 80 hours to work, and with 80 hours you will get the salary, like 15,000 to 20,000, and your house rent with family will be more than 10,000. So I don't think you will meet all the expenses
and
because
if
house rents are very high in Norway. Other
hmm.
expenses are also, and along with your fees and other things, bus traveling, I don't think it's wise to bring family if you don't have any other support.
So is the if someone comes and they are living with their family, is the medical and schooling, is it free in Norway?
Uh,
Yes. This is absolutely free. Don't need to worry about it. Even you will get money per child per month from the
Oh,
state.
okay. So
there are some schools, private schools here in Norway, British schools. They require fees. Otherwise, if you admit your child in local schools, in Norwegian schools, they are completely free. For doctors also, it's technically free. There's a minimum amount you have to pay, and all facilities are being offered to you.
But
okay.
you can only bring your children if they are 6 years plus. They are free. Before
Yeah.
6 years, kindergarten, it is crazy
Yeah.
expensive.
Yes. Yeah. Same in Denmark. It was all about the process from coming your country to Norway. But for
Yeah.
today, it's enough. And I would like to ask your final words from Dr. Ali and then Dr. Azmat. And then we will continue on some other day about with other topic.
My final words are, if you are dedicated and want to come to Norway, it is a cheap process. Not too much money is involved. Fees is like 1650 crowns for registration, then visa fees is not too much. Don't hire any agent, please. Do it yourself. And if you want to come, then join the groups on Facebook, or they can message you on your YouTube channel, and they can also contact us. If someone is from any part of the world, if he or she is in Norway, and I am here, and I also believe if Dr. Azmat is here, we will guide them as much as we can. And now I'm in a position to help people to get jobs if they promise me to learn language, minimum B1.
That's a very big offer from you, Dr. Ali. So nice of you, and thank you so much for that. Jazakallah khair. And words from you, Dr. Azmat.
First of all, as Dr. Rees said, you must be very dedicated that you don't consider the other countries, the options if you are coming to the Norway, because you should be well prepared for that. And whenever you get your license, then they can contact you or me or anyone, so that we could guide. For example, when I came here, I was totally blank. This was a blank country for me. I didn't know anything other than Oslo. I didn't know any place. Uh, Dr. Ali guided me a lot in this aspect. And whenever you come, you start your language and pay your full attention on that one, and things will go on the same way. And one more thing, in these countries, one thing is very good, that for example, you pass your language in Sweden or here, you can, if due to any reason you cannot stay here, you can shift to the other country as well. So be patient, and it takes time. It takes time. You will
So,
find odd jobs for yourself, but try not to bring the family. You can put their visa, and not to bring them immediately if you cannot finance them. It's very expensive in Sweden.
so nice of you, both of you, Dr. Ali and Dr. Smith. It was very
Yeah,
informative for our new coming doctors to Norway. I hope it will help a lot to them. And inshallah, we will arrange a second meeting about other topics, and we will have a lot of question now below this video. So hope for the best, and thank you so much. May Allah bless you. Thank you so much.
thank you
Thanks
so
for
Yes,
your
much.
time.
yes. Thank you so
Thank
much,
you so
both of
much,
you.
both of you.
Jazakallah.
Jazakallah. Jazakallah
Jazakallah
khair.
khair.